welcome to In the Know. I'm your host, Emily Nuevo. The human brain could arguably be the most complicated organ in the human body. So, what are the main functions of the brain, and how, if at all, does the brain relate to learning disabilities, and how we can keep our brain healthy? Well, tonight we have the CEO and Clinical Director of Spine Group in Vaughan, Dr. Connie DAstolfo, with us here tonight, and she's here to discuss rehabilitating the brain. Welcome to the show.
Hi, Emily.
Hi, nice to see you again. Welcome back.
Thank you.
So tonight's a pretty detailed discussion about the brain, what it does, how it functions. It's going to be...
It's an exciting topic.
Yes.
Very exciting topic.
Very interesting topic. So first, I just want to know, tell us a little bit about the Spine Group in Vaughan.
Sure. Spine Group is a rehab clinic. We're located in the Vaughan area. Mm-hmm. Our specialty is in spine care management and cognitive rehabilitation, which we'll talk about today, and vestibular rehabilitation and senior care. So we do a variety of pretty broad-based rehabilitation. And what makes us unique is really our program-based, evidence-based, integrated type of care that we provide. And our main focus is on chronic disease management and prevention, tied to these other areas of rehabilitation. And I'm actually very pleased and proud to announce that we've been voted the top physiotherapy clinic in Vaughan in 2012.
Wow, that's incredible. I know you guys do a lot of great work there. It's a local, facility here in York Region, and it's basically, when I think about it, it's sort of an all-in-one facility. You guys have, rehab programs there, physiotherapists, psychologists. I mean, really, it encompasses everything, right?
Well, it's a rehab facility, and what we do is encompass the variety of different professionals into our rehabilitation, and that's what makes it very, very unique, and we get really great results, and that's, at the end, what counts most to most patients.
And you've been in this industry for a long time.
I've been around
yourself,
for a long
right?
time. I've been in practice for, it's close to now 11 years as a chiropractor.
Mm-hmm.
That's my main clinical background, and I'm also pursuing a PhD at York in health management, so that's also a big area of mine. So research and consulting is a big part of also what I do.
And we were talking about before how you, Spine Group was created, how many years ago was it?
It's going to be about 4 years ago.
Yeah. Okay, great. So the brain, doctor, is a very complicated, organ in the body, like I said off the top of the show. Let's talk about, first and foremost, the main areas of the brain. Yeah. Okay,
we have a picture, maybe it can go up on the screen. Mm-hmm. And we'll start by talking about the frontal area. The frontal lobe is the youngest part of the brain, so that would be in that picture, I believe, the pink portion that the viewers can see. And the frontal lobe is the youngest part of the brain. It's the control center for the brain. It's the master control, and it's responsible for functions like reasoning, problem solving, empathy, judgment, impulse control.
Yep.
It's not surprisingly that it's the last to develop, and it fully develops when we're adults. So it can explain why teenagers and young adolescents may behave the way that they do, because they're not fully developed yet. So they may take risks that an adult otherwise wouldn't think twice about doing.
Oh, I didn't know that.
The occipital lobe is on the opposite side, so it's that yellow area that we can see there, and that controls visual sensation and processing. So basically, vision. So that's our visual part of the brain. Our parietal lobe is sort of the blue area that the viewers can see on the screen, and that's involved in processing pain and touch sensation. So when there's back pain or neck pain, that information goes back to that parietal lobe, and that's how we interpret it as where the pain may be. It's also associated with cognition. So it's with language and math skills, which we'll talk about a bit later on, and how we can improve those skills by improving the functioning of the parietal lobe. The temporal lobe is indicated by the green area on the screen, and that's involved with sounds or auditory sensation, and also with language recognition, so speech. Mm-hmm. So let's say if a person suffers from a stroke, they may damage what's called Wernicke's area in the temporal lobe, which is commonly happens, and this is why they lose the ability to speak. The limbic system is the oldest part of the brain, and it does show there actually on the second image. And that's our oldest part of the brain on the right-hand side. And that controls emotion and learning and memory. So fear, anxiety, depression, all these kind of things are actually attributable to the oldest part of the sort of the more animal part of our brain. Animalistic part of our brain is the limbic system. Right. That's our limbic system. Cerebellum controls movement and balance, and the brainstem, which is the lowest part of the brain there on that left side, is for our vital processes, heart rate, blood pressure, respiration, swallowing.
So a lot of areas there.
If any damage, unfortunately, happens to the brainstem, then that's not a good thing.
So it seems like, is the frontal lobe then the largest part of the brain?
It is the largest part of the brain.
Mm-hmm. And it, like you said, it is always developing. It's always, you know.
Well, all areas continue to develop in one way. You can say that. Right. But full development is about young adult. So 18, 20 years of age, your brain fully develops, but you can keep sharpening your brain. So you can keep it healthy and young. And that's an important thing to know. So it's like a muscle. Your muscle may fully develop a particular muscle may develop when you're 20 years of age, but as we can see in bodybuilding, you can make that bigger and stronger.
Manipulate it. You can.
Right. Same thing with the brain. The brain is like a muscle, and you could strengthen it to become sharper and more focused and brighter.
So let's get into the main functions of the brain then. I guess switch gears and talk about that.
So we mentioned a bit about the different areas. So now let's talk about the key function areas and how they go back to those main areas of the brain. So memory is one of the most important areas of the brain. So memory is sort of key to developing all the other areas of the brain. And for most people, it's the most important part of their brain.
Huge part. I mean,
it's the most important part. People who are starting to develop signs of dementia, as an example, will first see changes in memory.
And we'll talk about that in
and we'll talk about that more with dementia and Alzheimer's later. Yep. Executive functioning, that's predominantly in the frontal lobe of the brain, which we just mentioned earlier. And that's to help you with that's for help you foresee goals, take the steps necessary to execute your plans. Mm-hmm, mm-hmm. So planning,
like
organizing, scheduling, all those things happen in the frontal cortex. So if there's any kind of damage or problem or dysfunction in the frontal lobe, that's how it manifests, and those deficiencies in those areas. Mm-hmm. Language and math, those are again in the predominantly in the parietal lobe. Visual spatial in the back part, so that helps you perceive information around you. And then there's two other areas that are equally important that we didn't really mention, sort of the phases, and this encompasses the entirety of the brain, and that's the emotional response and social responses of the brain. And you may have heard of that as social intelligence or emotional intelligence. Those are two big key functions of the brain.
I mean, there's so much there. It can get kind of overwhelming when you think about how the brain functions, but at the same time, really interesting to see how everything kind of connects together. So when we come back from break, we'll talk more about the functions of the brain and how it relates to keeping your brain healthy and possibly learning disabilities as well. So stay tuned, more on rehabbing the brain when we come back. Welcome back to In the Know. Tonight we're talking all about rehabilitating the brain. And don't forget, our phone lines are open all hour for your questions or comments for Dr. Connie DAstolfo from the Spine Group. So we talked about the functions, we talked about the areas of the brain. Let's talk about how the brain ages and the phases it goes through.
Sure.
Okay, so where does it start first?
Just a couple of facts about the aging brain. Brain weight, the weight of the actual brain does change as we age, but that's a normal thing. So you will actually lose 5 to 10% of the weight of the brain.
I've heard of that, yeah.
Between the age of 20 and 90, you'll lose about 20% of brain weight. But that can be normal, so that doesn't have to impact any cognitive ability, which is nice. You may also see plaquing in the brain. We'll show some images later on what I'm talking about, but some plaquing known as senile plaquing can be also normal aging process, which may not impact the brain at all. Those are the two main areas. You may lose some chemicals like dopamine may diminish a little bit. A little bit is fine. Too much, then we call that disease Parkinson's, when it's too much dopamine that's being diminished from the brain. So some chemical changes may occur. A little bit of plaquing may occur. The size may decrease a little bit somewhat. But if cognition is good, if those functions that we talked about are sharp, then that's okay.
So how does a normal brain look like? Let's break it down now.
So a normal brain would be pretty large capacity, as you can see in that image. You're not going to see any visible plaquing in the brain. Now, an MRI can be T1 or T2 weighted imaging. This one here is a T1 image, so you're going to see
Is it more detailed, or what does
it's not
that
as
mean?
more detailed, but all the areas in the brain there in the white, that's normal.
Ah, okay.
And so that's a normal brain, we would describe. So it's normal size. It's not too big, not too small. There's no degeneration around the outside of the brain, and there's no plaquing.
Now this is a picture of what?
This is an image of the aging brain. So you can see a little bit on the outside. There's more space between the brain and the cranium, the cranial cavity, the head, right? But within normal limits, that's normal. So you do lose about 20% of brain weight. So you're going to see a little bit of shrinkage, but that's
It does
normal.
look smaller, yes.
But that's normal. So
Okay.
you'll also see a little bit. You may see a bit of plaquing in the brain as well, but that's still considered normal.
Now moving on to maybe somebody who's suffering from
So this
mild case.
image 3 is a patient who would be suffering from Alzheimer's. So what you'd find is larger areas of plaquing in the brain, and you can see that evident in that MRI imaging.
And how about somebody who has an advanced condition?
Well, this is an image now of a patient who would be having an advanced stage of Alzheimer's. There's a lot of plaquing around the
I mean,
perimeter
it seems
of the brain.
bright. It seems like a lot of white areas here.
That's abnormal.
This is abnormal looking.
That's an abnormal brain. Not too much shrinkage in this particular image. However, there's a tremendous amount of plaquing, which would be indicative of advanced Alzheimer's.
Wow. Let's talk a little bit about Alzheimer's and dementia. I mean, September is coincidentally Alzheimer's month, right?
That's correct, yeah.
And I mean, you wanted to discuss some points about that. Why is it so important
Well,
when
Alzheimer's
it comes to the brain?
Alzheimer's
specifically?
is becoming more prevalent, and reason being is that chronic diseases in general are becoming more prevalent. And I really want to stress in today's segment with you is that it's so important to really be aware of some of the chronic diseases that will make you have a high risk factor for conditions like Alzheimer's disease. Alzheimer's is a form of dementia, but it's a pretty bad form of dementia. It's very progressive. Eventually it will take your life, so it's pretty advanced. You'll start with issues with your memory, and then eventually, it'll pretty much eat away at all brain functioning. So it's a pretty tough disease to go through, both for family and for the patient suffering from it. And if we can prevent it by avoiding some of the other chronic diseases that we know we can prevent and manage, then that's an important thing to know, and we can do that.
So that is sort of my main question. I mean, are there concrete ways where we can prevent such a debilitating disease like Alzheimer's in our lives?
Well, there are a lot of
we can take control of that
lifestyle factures that are attributable to dementias. We'll say dementias in general. Alzheimer's is just one of those, just more progressive. Education is one of the lifestyle factors that we have total control over. So education meaning if we use it, we won't lose it, and that remains true to brain function. So use it, practice, and you won't lose functioning. That's an important piece. Exercise is vital in brain health.
You hear that over and over again. So exercising is good for your physical, your physical body, and also for your brain?
Also for your brain. It's just as important as it is for the rest of your body. It's even more important for your brain. Your brain takes about 20% of oxygen.
Yeah.
So it needs a tremendous amount of oxygen, water and oxygen, to function properly. So cardiovascular exercises, running, walking, skipping, jumping, you name it, swimming, those are excellent ways to keep your brain healthy.
Especially in your later years? I mean, doctor, can you pinpoint the age range in which,
I would say
cardio is the most important?
I would say, given the way the society is moving now, right away.
Right away.
Right away.
In your 20s.
Exercise is important for your child, recreational sport, all the way into your elderly years. So that's an important piece, important risk factor that we can modify and control. Third one is rest. Having 7-8 hours of sleep is really important
we
in
hear
brain
this
health.
all the time. Really? How
Very
about 5,
important.
6 hours?
7.5 is considered now gold standard. New research is saying 7.5. Used to be 8, now 7.5 hours is gold standard. 8 is fine as well, but
So what happens when you
doesn't
have
cut
5
it.
hours of sleep? What happens to your brain?
It's not enough for you. You won't be able to. When you sleep, your brain rests, and your body rests, and that's how you heal. So any kind of damage you have to your body, when it needs to replicate more cells, that's when it does that. If you're not getting enough sleep and that's disturbed in any way, you're going to lose that ability to heal properly. Is one major factor.
Even just with 2 hours less
If
sleep,
if it's
5 to
consistent,
7.
yes. If it's once in a while, not a big deal. But if it's consistently less than 7 hours, and yes, it makes a big impact. It makes a huge impact on learning and cognitive functioning as well.
So routine and patterns with your brain, important?
It's very important.
Very important. And stress.
Stress
Just
is
quickly
big
about
too.
stress.
And stress, you can tie it back to rest as well. If you're not sleeping enough in the morning, your brain, you don't rest, you will be more stressed. But stress also has a more encompassing problem. It actually, when you're stressed out, you have cortisol that's released, and that causes a tremendous impact on the rest of your body.
Okay, I'm going to have you hold your thought right there. When we
Okay.
come back from break, more on rehabilitating your brain. Welcome back to the show. Tonight we're talking all about rehabilitating the brain. So doctor, let's just talk a little bit about, a normal aging brain compared to a brain that, or a person who suffers from dementia.
dementia or
Because
Alzheimer's.
that dementia and Alzheimer's is just becoming so prevalent in our society today. It's such a debilitating disease.
Absolutely,
It's
yeah.
really, really sad.
Well, normal aging, nobody's brain is perfect. People have some deficits, right? But normal aging, you might not remember all details of every conversation, as an example, and that can happen. That could be normal. Whereas someone with dementia or Alzheimer's may not even remember having that conversation at all. So that's a pretty stark, difference.
So how, should, parents and seniors, when should they start worrying if it's just normal forgetfulness and something really, really severe, or is it something family members need to
I think
take note
family
of?
members would probably take notice first. They may notice that their loved one can't remember details of an event that just recently happened.
Okay.
We're talking maybe a day ago or maybe a few hours ago. Or they may not recognize the names or faces of their family members or friends that they know very, very well.
I see.
They may lose sight, they may not remember certain words or can't string words together again. So that's another sign
So
of...
those are indicators.
Right, those are big indicators. Forgetting events, important events, also like birth dates and anniversaries, those are pretty huge too. Or losing things, forgetting things. That's a common one that you hear a lot.
So what's normal then? Because I know, a lot of my friends may not remember, I don't remember what happened 5 years ago when we were this age, and
That's normal.
That's
normal. But not remembering what you did just a few hours ago is not normal.
okay.
So that's a pretty big difference.
Yeah, huge difference, huge. So what are some of the other sort of chronic diseases related to brain functioning?
We talked a bit about stress in the last segment, so if we just bring that back one more time.
Gosh,
Stress causes a lot of problems. So brain is just one. Stress is just tremendous, and the reason why it has such a huge impact is because of a hormone called cortisol that's released in the body when you're stressed. So stress is your fight-flight response. So your sympathetic system is on overdrive, and you just want to, everything is shut off, and just so you can get away and escape. That's that reactive response that we have, fight-flight response that we have. But when it's overdone, when it's chronic, when it's too much, And cortisol is constantly being released in the body. What it does to the brain is actually the cortisol actually physically eats away the neurons in the limbic system predominantly.
So let's just take it back to the top of the show. Limbic system is the older part of the brain?
The older part of the brain,
So
the
what does that mean
animal instinct part of the brain that controls fear and emotions. And
so it starts affecting that when stress levels are high?
Right. And that's why you feel anxious. That's how you can tie stress with anxiety and with depression, because depression is sort of the opposite of anxiety, but it's sort of the low of the brain, whereas anxiety is the high of that brain.
I see. So how can we control that? How can we prevent our stress levels from increasing and ultimately affecting our brain?
Well, there are ways. I mean, relaxation techniques, learning just how to handle a situation. Cognitive behavioral therapy is a good strategy if somebody's having difficulty controlling their stress. Then a psychotherapist, like somebody in my clinic with our program, would be able to teach you the techniques on how to manage your stress so it doesn't become at such a high elevation where it's causing damage to your brain.
And at the Spine Group, you offer those types of services in terms of programs to help?
Well, we have a cognitive rehabilitative program, and in this program, it's a 12-week. We have it in a 12-week program.
Right.
And you know, candidate can be anyone from a child with ADHD or learning disabilities all the way up to somebody with mild Alzheimer's. I mean, we can't do much when it comes to the moderate and advanced stages, but the dementia stage where it's sort of mild Alzheimer's, and there may be ways that we can help manage that. So we use an integrated approach, obviously, and dietary solutions, supplement, the cognitive behavioral psychotherapy, CBT, and physiotherapy. We'll talk a bit about how exercise, not just the cardiovascular exercises, but vestibular exercises can help manage these types of conditions. But we'll go through that a little later on in the show.
And I know you have lots of information on your website as well if people want to look for those services. Let's talk about another chronic disease. Diabetes is another very common condition. It seems like people are suffering from more and more often.
It's a hugely prevalent condition, more and more, because of things like inactivity and obesity is really driving the rates of diabetes. And fortunately, is one that we can actually control.
Yes. So what are the main points then about diabetes?
So diabetes, basically, when your glycemic when your glucose is out of control. That's why diabetes happens when your glucose becomes out of control. So your pancreas is no longer able to metabolize glucose, and then you get the spikes, the insulin resistance or insulin spikes.
So you need to control the insulin.
Right. So what happens in terms of insulin? Insulin will actually start to break down neurotransmission. So this resistance that's created due to the diabetes will impact the brain via the neurotransmission issue. So neurotransmission just means the impulses from cell to cell, neuron to neuron. Usually it's a speed of about 200 miles per hour or so. So that'll stop that, either stop the transmission or slow down the transmission. And this
if you have diabetes.
Or if you just have insulin spikes. So for example, let's say if you're eating too much sugar, you're not getting enough.
The sugar ruch, people say, right? You're stuffing your face.
And you may notice,
with
I can't remember why
food.
I don't remember this, or why I can't remember this word, or why I feel so stressed.
Really?
That's how it impacts it, because it will actually halt or slow down neurotransmission in the brain.
Wow.
So that's how it impacts cognition. And diabetes is in our control, so we should.
Well, diet,
we can manage
like
that.
This is what we need to control. Diet, and in terms of a sugar intake, when it comes to
diabetes? In terms of the types of sugars that we choose, choosing more complex carbohydrates instead of the simple carbohydrates, right, the sugars, so you metabolize it slower. Having good, lots of raw fruits and vegetables, good quality proteins. Protein tends to keep sugar and glucose values at a balanced state.
More balanced, yeah.
So eating your glucose, anything that's sugar, anything that's carbohydrate should be always balanced with protein in a meal to keep it more steady.
Okay, so when we come back from break, more on rehabilitating the brain. Stay tuned. Welcome back to In the Know. Tonight we're talking all about rehabilitating your brain with Dr. Connie DAstolfo from SPINEgroup in Vaughan. So, Doctor, you wanted to talk more about hypertension. What is that exactly?
Hypertension is when your pressure exceeds 140 over 90. So let me just explain what that means.
Yes, let's break down the numbers.
People may not know numbers. So 140 is your systolic blood pressure. That's your highest number. And what that indicates is the value of pressure in the blood vessel when it's at the highest point of dilation. The lower number is when the blood vessel is at its lowest point of relaxation. So normally you want under 140 over 90. Now a good value for blood pressure is in between 110 over 70, or can even be a little bit lower, to 135 over 85. It's considered normal blood pressure.
So when you low blood pressure is bad. So what's an example of low blood pressure?
Low blood pressure is only bad when it's associated with dizziness or feeling fatigued. So if you have any other symptoms tied to low blood pressure, then it can be bad. If you don't have a problem with low blood pressure, then it's never considered a problem. High blood pressure is more of a problem.
So again, to repeat the good numbers when it comes to, I guess, balanced blood pressure.
135 over 85, and then the lower range is about 110 over 70. So those are your good numbers. So 110 over 70 to 135 over 85 is considered normal blood pressure range for the population.
And why is this important in general, to get your blood pressure checked regularly?
It's important because it's what we call in the medical profession the silent killer. We don't know you have high blood pressure until you measure it. And you may not have suffered the impact of high blood pressure until much later. So blood pressure, just to kind of explain what happens in the blood pressure, your blood vessel is elastic. So when blood is going through your blood vessel, if there is too much plaquing around that blood vessel, it stops it from being as elastic as it should.
Right.
And then your pressure will increase. So it just means that pressure is an indication that there's damage and plaquing around your blood vessels, and that's the important piece. So you have plaquing that can clog your arteries, causing potentially strokes and heart attacks, and
plaquing in your brain. I mean, we talked about it earlier in the show.
Well, plaquing in the brain is different.
Different.
So senile plaquing in the brain is actually from neurons, the brain cells that are actually dying off. So that's why it's normal, because you will have some dying neurons.
Right, when the brain ages, like we discussed.
Right, but when the plaquing becomes excessive, it means that there are too much neurons dying in the brain. So that's the difference. And hypertension is just like glucose, just like the diabetes issue, can contribute to that. And the way it does that is because there's less blood flowing to the brain. So when you have hypertension, you have the clogging and the blocking in arteries, you're not going to get enough into the carotid artery or the smaller arteries in the brain.
And I mean, this is why I find this topic so interesting, because it all sort of relates to the brain. Everything that's happening in your body relates to what's happening up here, and
that's
affects it,
that's
right?
absolute truth, yeah.
So, like you said off the top of the show, your brain is like a muscle. You need to exercise it.
You need to keep it healthy.
Keep it
Just
healthy.
like somebody who's physically active understands that. Well, it's also important to keep the brain physically active. And it needs the ingredients to keep it healthy is good diet, supplementation if you need that,